Okay, here we go. Ding, 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 and a 1, a 2, a 1, 2.
Welcome to Stony Brook University's Beyond the Expected podcast. I'm Michael Bernstein, the interim president of the university. Like many sectors today, healthcare is embracing the virtual world. Telehealth and the telecounseling component of that are meeting people's increasing needs for support and comfort at a time when in-person care is neither available, nor advisable, nor safe. We're so fortunate today to have three amazingly qualified professionals who will share their perspectives, right from the driver's seat, if you will, on how Stony Brook University's ramped-up telehealth efforts are going, who's benefiting, and what we can expect in the days and weeks ahead. Joining us remotely today are Catherine Duffy, Christy Golden, and Adam Gonzalez. Let me introduce them before we start our conversation. Catherine Duffy is the director of Healthier You, a program focused at Stony Brook on the total well-being of our employees. As you can imagine, Catherine's role has shifted dramatically in the force for the 4 or so weeks since she's actually been in her position. She's a brand new colleague. We're going to ask Catherine all about how she and Healthier You are stepping up their game to provide the level of support a pandemic crisis demands. We'll also get to hear the kinds of issues the university's Counseling and Psychological Services Unit is dealing with, our CAPS unit, as we call it, from the vantage point of the Division of Student Affairs, where Catherine previously worked. Thanks for joining us, Catherine.
Thank you.
Christy Golden is the Associate Director of Operations for Stony Brook Medicine and a member of the Hospital Administration Executive Staff. She oversees all operating aspects of psychiatry, neurology, and related areas of practice. Christy also spearheads the advancement of our telehealth initiatives in these areas. We'll get an inside look from her at exactly what telehealth and telecounseling are and how it's giving people the care they need while helping stop the spread of COVID-19 and easing overload in our university hospital itself. Looking forward to hearing what you have to share, Christy.
Thank you.
And our third guest today is Adam Gonzalez. Adam's the Director of Behavioral Health and the founding director of the Mind-Body Clinical Research Center at Stony Brook's Renaissance School of Medicine. Adam's a licensed clinical psychologist and an expert in cognitive behavioral treatment. He's also helping to lead support services for employees at our hospital at a time when the need for such increased support couldn't be greater. Adam, we're looking forward to talking with you today about the counseling services we're providing and who's taking advantage of them.
Thank you.
So, Christy, let's begin with you. Telehealth isn't a new concept, but perhaps you could take a moment to explain to our listeners and viewers what it is. It's taking center stage today, and as you elaborate, maybe you could give us a sense of the numbers. How many people in the community are taking advantage of these services?
Sure. So telehealth in general is a way for us to see and communicate with patients in a digital world. And there are more and more opportunities to do that, especially with the advances in technology and our ability to generate data and use data to help us to assess patients in a distant way, where a patient is in one location and a physician is in another. So for our community, we had a few telehealth projects up and running at Stony Brook prior to the pandemic. But when we began to see that this was becoming more and more of a necessity because of the spread of the virus, we really put it into high gear. So about a month ago, we started to move more departments in that direction so that they could gear up quickly to see patients and to be able to serve our community members. So I would say we were doing probably about 14 telehealth visits a day about a month ago, and just this past Tuesday we had 800 scheduled for this single day.
So are you deploying telehealth across all areas of practice, or are you just concentrated in particular areas? How has that changed?
Psychiatry and neurology were among the early adopters, but now we're really gearing up in the primary care areas, and it's available in almost every specialty at this point.
So maybe you could take a moment, tell our listeners and viewers what telehealth care looks like. Walk us through what might be, if you will, a typical virtual visit. I mean, I understand it may vary by practice specialty. That might be interesting to hear about, too.
Sure. So a patient virtual visit is very similar to what it would be if you were face-to-face in your doctor's office. So a patient would call the doctor's office and schedule an appointment. And depending on the particular technology that the physician practice is using, they will send you an invitation. And in that invitation is a video link so they can have a face-to-face conversation with you in the same manner they would if you were sitting on the exam table in their office. So they would walk you through the same process. They would ask you questions about your symptoms. They would ask you about any challenges or issues that you're experiencing. They may take data from you. Some people take their temperatures at home. Other people have wearable devices where they'll convey information to their physician. Sometimes physician practices will supply certain types of equipment ahead of time so that they can gather information from a patient remotely. A good example of that is a specialty like cardiology. So cardiology has many different types of devices to monitor patients' heart rates and use what's called remote patient monitoring. So there are a lot of people familiar with the devices that a cardiologist might send them home with, an ability to actually convey data back and forth electronically so the physician has that information at their fingertips.
This is very interesting. Let's just dwell on this for a second. I mean, most people, I'm sure, most people think about a visit, to a physician or to a nurse practitioner. I mean, this is literally a laying on of hands. You're being examined for some purpose. So you're describing a whole new world where there's a virtual laying on of hands, and that this involves really the patient themselves doing the tests or the examining and then sharing that information in various formats with the physician or the physician's assistant that they're communicating with, right?
Yes, correct. And it depends on which practice, as you said before, that they are seeing, which specialty they're seeing. In some cases, it's much more of a verbal exchange, and in other cases, they may ask for more specific information. And one of the advantages of having a patient portal is that information can be exchanged with the doctor's office ahead of time. So I encourage all of our community members, if you have yet to sign up for the patient portal, definitely do so.
So, what I'm hearing you say is we can expect that over time, the proliferation of telemetry, meaning devices and other connections for people at home to be able to transmit clinical information to their care providers, this is going to happen to a greater extent as we go forward.
Oh, absolutely. I think technology companies have huge opportunities ahead of them, and there's such creativity. And you think about the engineers that even the engineering department within Stony Brook, they're coming up with such innovative ideas and such tremendous ways of reaching patients in remote ways and by using data. It's hard to fathom.
So really a future, in a sense, maybe my phone. I'm like using my phone as a way to convey all sorts of information into the practice and then ending up in a telehealth session where the information has been shared, the physician or physician's assistant has been looking at it, and they're following up with questions and other assessments.
Exactly.
Interesting. So Adam, let me shift to you now. Talk a little bit about telecounseling and the behavioral area. Again, do you have some sense of the growth in numbers here? How many people are taking advantage of this? Talk a little bit if you see particular groups taking more advantage versus others. Tell us what you're seeing relative to what Christy has just shared.
Sure, absolutely. So as Christy was mentioning, psychiatry and behavioral health was one of the first departments to start piloting telehealth services prior to COVID-19. And since then, we've moved all of our services over to a telehealth platform so that we can provide both individual as well as group-based counseling services to all of our patients. So patients are connecting really well over this platform, and people are really starting to take advantage of this new type of service that we're able to provide to them.
I'm curious. Counseling sessions, by definition, are very private, of course. Very personal issues being discussed. How effective are you finding these sessions? I mean, you've had experience with this. I'm sure it predates the COVID-19 pandemic, sure. And maybe there's a lot of learning going on. But how useful, efficacious are these engagements to your mind?
Yeah, what we know from the literature and the research, the science that has been done looking at telehealth services versus in-person services, the effectiveness of treatment is about the same, and patients feel just as connected to the provider through telehealth as they do through in-person visits. So that's really a big plus that we know that there's some science to support this. Anecdotally, patients are really liking the sessions. They're definitely benefiting from them. There's some hiccups, of course, along the way with trying to get people connected. I think we're all having a steep learning curve in figuring out ways to get connected as well as to communicate differently in this way.
So, you mentioned connectivity issues. Independent of the connectivity challenge, if someone has appropriate computer equipment, if they have Wi-Fi and internet service in their homes, those things, leaving that aside for a second, whether they're technophobic or not, leaving that aside, have you had complaints about using telecounseling as distinct from, FaceTime engagements?
No complaints as far as I know. Things have been running pretty smoothly. Maybe just right in the beginning, people had still wanted to come into in-person sessions, but for the safety for them, other patients, as well as our providers and staff, we really encourage the use of the telehealth platform, and with some instruction and guidance from our staff, patients have really grasped onto it.
Well, that's an interesting point you've just gestured towards. So, in your mind, both from the standpoint of a provider like yourself, or from the standpoint of a patient, of a client coming in, what are the ingredients of a successful telecounseling session? What would be your advice to both parties to the conversation?
Yeah, first, definitely getting connected, and
right.
After that, there are some guidance that we give patients, making sure that they're in the frame, and as providers, we want to make sure that we're in the frame, we're looking at the camera versus looking at the screen, so that we can connect with the patient. Also, that the patient, we know that it's successful if the patient actually feels better. And so we're constantly checking in with our patients around how they're doing. Also doing assessments virtually as well through different platforms where we're able to actually have them report on their symptoms and their functioning and how they're doing. So we track outcomes as well over time.
So that's a very interesting point too. A teleconference session is not a one-off, right? It's actually part of a sequence of, if you will, pings and touching base with patients to see exactly what their trajectory is, right?
Absolutely. So we still do weekly counseling visits. So we schedule once a week with a patient individually, as well as through our group-based services. So we're in constant communication with them.
That's great. So, Catherine, let's bring you into the conversation. As I mentioned, you're our brand new director of Healthier You,
yes.
And we're delighted to have you in a significant leadership role at a very critical time.
Thank you.
Tell us about the services of Healthier You and so forth. Our listeners and viewers don't necessarily know about the organization.
Yeah. So we were just about to go live with a lot of really exciting in-person programming, and we've transitioned it online. We partnered with a terrific group, Project Presence, and this is run by Josh Hendrickson, Dr. Joshua Hendrickson. He's a graduate of our MSW program at Stony Brook, and he's an expert in integrated health and mindfulness meditation, and he and his team are helping us by running a live streaming meditations every weekday on Facebook Live at 3 p.m. And then we capture the video and put it on our website. I share it with Adam, and he shares it with the internal hospital channels so that our clinical staff can take advantage of it any time of day. And we've gotten a tremendous response. One of the reasons we chose Facebook Live is so that it would not be proprietary and open it up to the community. And we've gotten some really nice feedback from community members who have appreciated it as well. So it's facebook.com/healthieryou, or it's accessible on the Healthier You website.
Have you been able to start tracking numbers and volume? Tell us how that's emerged over the past week or two.
Yeah, it's increasing. We weren't having as many people watch at 3 and we were getting many more views later. And then I'm not able to track some when we embed the video elsewhere, but it's being embedded on the hospital internal channel. So I'm really not sure how many people are viewing there, but it's in the, each video is getting 400 and 500 views a day, which is cool.
Wow. I guess especially now with, the orders to stay home and, all of the public health guidance, people literally have more time and more wherewithal to engage with activities like these.
Yeah, exactly.
Is it still too soon to say, are you seeing a particular segment of the organization taking advantage, or are the data still too preliminary to make that call?
It's really been all over the map. It's been kind of exciting to see people from alumni affairs really engaged, and faculty and things like that. So it's been a wide swath.
Interesting. Adam, along the same lines, the staff support group you lead is obviously been ramping up to meet the challenges of this pandemic, and faculty and staff are engaging with that. I assume that's been a growing platform for you as well.
Yes, exactly. So we launched virtual staff support groups that we offer daily, Monday through Friday at 8 a.m., 12 p.m., 8 p.m., and then we also offer them on the weekends at 12 p.m. So those groups are just starting to take off. Staff are starting to hear about them more and more. During the group virtual sessions, we do meditations, we talk about stress management techniques, and we also have an open platform where staff members, employees are able to share their thoughts about what's going on and how they're doing.
And Catherine, you're part of this group too, right?
I'm part of the planning group, and it's been really incredible. They've given me a warm welcome as a new member, and I've been very impressed with, just the stamina of the clinical staff and how caring they are, not just for the patients, but for each other as a team. Just this morning we got a check-in from one of the doctors who I know is working, around the clock, and takes the time out to check in on our planning team, which really speaks to the caliber of this group of people.
Absolutely, and a little bit later in our conversation, I do want to focus in with all of you about the issues surrounding our medical teams and counseling staffs. Adam and Catherine both, maybe we could just switch gears a little here, talk a little bit about telecounseling services we're offering students.
Yeah, so as a former student affairs professional, I'm still very connected with the folks over in CAPS, which is an amazing team, Counseling and Psychological Services. They were, I think, on the verge of launching telehealth just at the beginning of the COVID pandemic, and now it is fully operational, and they've been running for 3 weeks. I spoke with Julian Pessier, Dr. Julian Pessier, the director, yesterday, and he was pretty amazed at how well it's going. They've managed in 3 weeks to transition 400 students over to a telehealth option. So students have the option of video conferencing with a therapist, or they can use the phone if they prefer. And apparently it's going really well. And students always had the option of calling the CAPS after hours line, which is 631-632-6720. And that's still true today. So even a student, who has never accessed therapy before through CAPS can, really, this is a great time to take advantage of it by calling that number 631-632-6720 to access a counselor 24/7.
That's important. Adam, anything you'd like to add to Catherine's observations in this regard?
I would just echo what Catherine was mentioning. CAPS has been a great organization and great place for students to seek care. We also see a fair number of students both through the Mind Body Clinical Research Center, Department of Psychiatry and Behavioral Health, as well as through the Krasner Psychological Center, the KPC, in the Department of Psychology.
Great. So let me get back to Christy here, but also I'll invite Catherine and Adam to join in. Christy, so obviously a unique set of circumstances facing the healthcare professions generally. I'm curious how you and colleagues decide which types of situations, are appropriately addressed through telehealth and telemetric practice, and which require, the more traditional in-person treatment. How do you go about sorting that out?
Well, I would say for the last 2 years probably, we have a very active telehealth work group that crosses all of the different schools across the university, faculty, staff, students that have been involved in investigating and researching different types of technology, different platforms to use, and making assessments as to what would work best for different patient populations. And each specialty brings with it unique circumstances, and they have an expertise that they gain themselves from reading through their peer-reviewed journals to see what their colleagues are doing across the country. So in areas like the Midwest, where they have more limited access to physicians, they are a little further along than we are in terms of advancing telehealth. So we can learn a lot from people in other areas of the country and other areas of the world. So that telehealth work group has worked very hard and launched some of those earlier projects. We had been working on one project at a time to make sure that it's being launched in the safest way, the patients are experiencing the best patient experience, and the providers are satisfied with what it is that they can do with those patients. So we're grateful for the work of that telehealth work group because it laid the foundation for the exponential increase in visits that we've had over the last month. At the patient level, I think much of it depends on the provider and the specialty. So when a patient first calls the physician's office and they're seeking an appointment, the person who's answering that telephone is going to gather basic information from that patient. And based on that information, they'll make an initial decision as to whether or not the patient needs to be seen in person or if the session can take place via telehealth. And if there's ever any question for that person who's triaging, they'll go immediately to the physician to ask for feedback, and the physician may speak to the patient directly to make that call.
So just to follow up on that, you mentioned this as you began your answer. Telehealth is not new to Stony Brook Medicine by any stretch of the imagination. It's not simply been the product of the pandemic. And in certain areas, we've been leading in innovative approaches in telehealth in unique areas. So the mobile stroke unit comes to mind. David Fiorella actually was a guest on Beyond the Expected some weeks ago to tell us about the mobile stroke unit and how it represents the very best of both hands-on and, telemetric practice. So maybe you could take a minute, Christy, and tell our listeners and viewers about that life-saving program and how it's paved the way in many respects for some of the successes we now enjoy at this present moment in telehealth.
The mobile stroke unit is a fantastic opportunity to reach patients in the community, in their homes. So it looks a bit like a regular ambulance, but it's specially equipped with a lot of technological advances in the inside. So it has a CAT scan, it has the ability to do telehealth consultations with physicians that are in remote locations, and it's equipped with some of the life-saving therapies for stroke patients that can be administered in the field, which would not have been able to be done on a regular ambulance or in any other circumstance. So the mobile stroke units bring the actual treatment to the patient. And if you've ever heard the saying, time is brain, what that means is that when someone has a stroke, you want to be able to assess what the situation is, what type of stroke they've had, in order to initiate some of those life-saving procedures. And by having the mobile stroke units out in the field, it cuts down a significant amount of lag time in bringing the patient to the hospital, and it saves more lives by being able to get to that patient and initiate treatment more quickly. And in addition to that, some hospitals are equipped to do certain types of procedures related to stroke, but not all of them are. So the mobile stroke unit can make that assessment in the field and get them to the right hospital much more quickly than in the past.
That's great. Thank you. Christy, Catherine, Adam, do you have anything to add on this issue of decision-making about the utilization of telehealth techniques in your own organizations and in your own practices? Christy's obviously described for us a set of protocols by which decisions are made, both at the group level and at the individual practitioner level. Anything you'd like to add on that score?
Adam, I'll let you go.
Sure.
Adam, you're up.
Well, I would say for mental behavioral health, where most of the work that we're doing is talk-based therapy, if not all of it. So it's very feasible and acceptable to be able to deliver services to our patients in psychiatry in this way. As part of cognitive behavioral therapy and some of the other interventions that we employ, there's often homework assignments given, reading material, and even through telehealth, you're able to do a lot of that by uploading files, sharing your desktop, sharing your screen to show patients educational material or different worksheets that might be helpful for them.
And this is precisely why, listening to you, Adam, it occurs to me, this is precisely why the behavioral and neurological units have sort of paved the way in telehealth for Stony Brook Medicine. I'm talking now over the years. This is long predates COVID-19.
Yeah, absolutely. Absolutely. I think in that way, we're very fortunate that we can provide this service and continue it through telehealth capabilities.
Catherine, you want to chime in or no?
Well, I mean, I know with the CAPS after hours line, that's existed for quite a few years. That has been used as a triage if students call in after hours, if there is an acute situation. It will be attended to, rather quickly. Otherwise, they'd have an appointment the next day at CAPS.
So let me draw all three of you in. This has been alluded to in some of your answers already to some of the earlier questions I posed. Let's talk a little bit about our healthcare teams themselves. We know that people struggling in this pandemic obviously require care. And in general, we're seeking to provide care to a patient population spanning our region through telehealth and telecounseling. But right now, given the incredible pressures and tragedies associated with this pandemic, our frontline healthcare workers themselves are being pressured in ways that are unique. There's no more stressful venue, I think, in the present context than the front lines in our hospital and other organizations like that. So whichever of you wants to start, let me pose the question, what are some of the things we're doing now to care for our caretakers online and in person to help them cope and to stay healthy themselves?
Sure, I can start. First, I'd say we're super proud and super grateful to all of our healthcare workers, our nurses, our doctors, as well as the staff helping to keep everything operational, especially housekeeping staff, custodial staff. And a big thank you to all the nurses coming down from upstate to help us provide services here at Stony Brook Medicine. They're actually arriving today, which we're super grateful for. In terms of caring for our staff, we have a really amazing team that has come together, including Catherine, as well as Dr. Megan Lochner from our Team Lavender program, Dr. Cynthia Savoni, who leads our faculty staff care team, as well as our CL psychology service, and Colleen Stanley, who leads our employee assistance program.
Adam, maybe you can tell our listeners and viewers about Team Lavender.
Sure. Team Lavender was just getting started right before COVID-19, and we launched our first pilot, led by Dr. Megan Lochner in OB. And through our NICU. So after a crisis or a traumatic event that occurs, a code Lavender or Team Lavender can be called to respond to that crisis or event to provide emotional support for staff. So it's called Team Lavender because traditionally people would bring lavender oil or actual lavender pieces because it has a calming effect. So it includes nurses, social workers, psychologists, as well as our chaplaincy group would respond as a group to some of these situations.
I think we often forget, I'll speak for myself, I often forget that when tragic incidents occur, and of course, unfortunately right now, daily, the numbers of tragic incidents occurring in our hospitals are going up and up in the throes of this pandemic. We think obviously of the tragedy themselves and the impact on bereaved loved ones. That immediately comes to mind. But we forget that our care providers, they're on the front lines and they're being traumatized at the same time. And they need care and support especially now as the volume of these tragedies accelerates because of this pandemic itself.
Yeah, I can add, we're using Microsoft Teams right now to provide and streamline all of our support services for our employees at the hospital. So we set up a Wellness Champions channel that all of our support resources are posted there, any free programmings that might be going on in the community, so employees could access that through Microsoft Teams. We also have launched a No Heroes, Not All Heroes Wear Capes initiative, and that was led by Dr. Megan Lochner, where community members as well as students can send in messages, pictures, video messages of support for our employees, and so they can email those to stonybrookwellness@gmail.com. And that's been a great hit for our employees and staff.
Your point about no heroes, I just mentioned I was briefed yesterday. This was not a medical setting, so this was not literally a life and death matter, but I was briefed about a meeting that apparently had not gone well. Things got a little out of hand, and I simply replied, everybody's nerves are pretty frayed right now, and we're all human, and none of us should ever apologize for that. That's just who we are, and sometimes tempers are going to flare and they'll be upset. Catherine, with regard to Team Lavender and Code Lavender, I assume Healthier You has been involved in the thinking through of these protocols?
Well, I've been invited to join this incredible team, and I was just getting to know them, and to see them now in action, really with more of a need for these codes
than ever before.
Daily, it's remarkable. And, Adam alluded to the Employee Assistance Program, and Colleen Stanley, who's been a long-time counselor for our EAP, has been just a tremendous support as usual. She was here at the university during Hurricane Sandy and really provided tremendous support to staff then, and this continues now. So I get the privilege of working closely with Colleen, and it's been really tremendous to see that, I'm noticing she's become a resource for the other EAPs across New York State. I'm part of a listserv now, and people will say, hey, I found out about this site, and, Colleen will have posted it already.
And the EAPs, you mean the Employee Assistance Programs that
Yes.
all of our campuses have?
Yes, every state agency in New York State. And Colleen really has become a resource for all of them and is constantly sharing information, not just internally here at the university for the benefit of employees, but for colleagues at all the other agencies.
And it's worth emphasizing Catherine's mention of EAP. Our employees, I think, often should be reminded that when they're facing challenges in their own lives, and obviously right now we're all focused on, for understandable reasons, on the pandemic of COVID-19, but in quote normal times, challenges associated at home, financial challenges, behavioral challenges, health, mental health, whatever the issues might be, there is an EAP office, and it's there specifically for all members of our family, as it were, at the university to reach out and ask for counseling, advice, and referral, and it's all done obviously on a confidential basis and a wholly professional environment. So it's worth reminding people of that. Christy, I'm just curious, with respect to Team Lavender and Code Lavender, I assume that your team, with respect to operations, is linked with them to learn from them about potential initiatives elsewhere in the telehealth realm.
Oh, yes, of course. We're in contact with so many organizations across the region that are giving us good ideas about things we can do. Just recently, there was a conference call that was held by the county and the state among the local hospitals, specifically among the departments of psychiatry across the region, to talk a little bit about what each hospital was doing to address the needs of their staff. And Adam had mentioned a little bit about the services that we're offering, the virtual services that we're offering to staff. But on a more concrete level, I wanted to also mention that we have set up a unit within the hospital that's a staff respite area, and staff can go there. As Adam mentioned, there is essential oils, there are snacks, there's coffee, there's resting places, there's showers. They can go there. There's actually televisions set up for people to be able to play the Wii or do things during their breaks just to decompress from the circumstances.
A safe space.
Yeah.
A safe space, right.
And one thing that is really amazing is one of the volunteers that's in that area, which is a part of our psychiatric staff, went on YouTube to learn how to make animal figures out of towels. So they could make animal figures and place them on the beds, along with small pieces of chocolate that were donated from the community to place on the pillows, so that if a staff needs to come and take a break, or for those that are working during much longer hours and they need to rest, they can go there, and it's really set up like a sanctuary.
That's wonderful. It occurs to me, again, hoping and assuming that in the not too distant future we can begin to put the COVID-19 pandemic in the so-called rearview mirror, things like this will remain. So the respite place for hospital teams will always be there to support our healthcare workers in times of stress and crisis. Can you tell us, Christy, a little bit about the iPad program? I think I have the right terms for that, for inpatients and for healthcare providers.
Sure. So both on the outpatient and on the inpatient side, we're using a program called Microsoft Teams to facilitate communication between clinicians and units and patients and families.
Adam had mentioned this briefly, but yeah, tell our listeners and viewers a little more about this.
Sure. So we have actually an iPad drive, and we've gotten many, many iPads donated from the community that we're reconfiguring so that they can be used in different ways. Some of them are being used to help facilitate communication between physicians and nurses and the actual patient themselves, so that we can keep the patient safe and we can keep the providers safe. And anytime you can limit the exposure to one another, you're keeping that individual in a safer place. So we're using some iPads for that purpose. Patients are also choosing to use their own device. Some of them have smartphones where they're using Microsoft Teams to communicate with their clinical teams. And in other cases, we have patients that don't have their own device, so we're supplying them with iPads with this capability. And our whole goal is to keep people connected, not just on the clinical side, but also keep patients connected with their families. Right now, we can't have family visitors who would normally be at the bedside. So that is very distressing to both families and patients, and it's very hard for providers to see patients go through that. So the more that we can connect patients, even if it's by video alone, it's a much better opportunity and a much better situation than patients not being able to communicate at all with those that surround them and their loved ones.
I think I'm grateful you've mentioned that, Christy. This obviously one of the most challenging aspects of this entire crisis, both for patients, as you described, but also for people who fortunately are remaining healthy, but nevertheless are sequestered at home and are practicing social distancing. There's no opportunity to be together in the real-time sense. And I've reflected on this all of the past few weeks with the elaboration of this emergency. In most crises, whether it's a storm like Sandy or, the horrible attacks on 9/11 and 2001, people come together, literally, physically come together to be together, to share support, to share interaction. And this is another one of the unique and very challenging aspects of this emergency. So it's interesting to hear about this initiative.
May I add to that? We're hosting a lot of our normal meetings that we would have among our staff and faculty by Microsoft Teams as well in order to ensure appropriate social distancing. And one of the funny things is people are working different shifts, so some people will call in from home, and a pleasurable part of it is you'll hear a dog bark in the background, or you'll hear a child laughing, and those are the nice things about being able to do things from a remote location, and it makes the meeting much more interesting.
Yes, well, we get to see people's homes, maybe get to see them in different clothing. I was on a meeting some days ago with senior SUNY leadership. The SUNY provost was transmitting from his home, and suddenly a cat appeared in the screen. The cat wanted to participate in the meeting, so that was all very nice.
It makes it very interesting for doing therapy this way as well.
Well, I did hear a report apparently on the retail trade out of New York City, the retail clothing trade. Sales of tops are way up, but not of bottoms. So let me ask all three of you, all of this discussion about telehealth, telecounseling, and the engagements with it, I mean, it raises questions about privacy and the protection of personal information. So I'm wondering what you and your teams are doing to address these issues. Obviously, you operate within a regulatory framework that requires patients' privacy to be rigorously protected, but in this brave new world of the digital platform, how are you approaching those challenges?
I would say on the outpatient side, we're very transparent with patients around privacy issues and those concerns that we too share around keeping visits confidential. So providers are actually able to download our like white noise apps on their phone, so they can actually have white noise playing in the background to drown out any sounds in their own space. And then we tell patients as well to be mindful of who might be around. For some people, it may not be safe to talk in their house, so they may drive their car to a remote location or sit outside by the beach and have their session there on their smartphone.
It's an interesting point you bring up, Adam, especially in the behavioral medicine field. Normally there is literally a safe space that somebody goes to engage with a care provider. When we're doing telehealth, there is this question of, where can you be safe, secure, and confidential in working with a care provider? And as you say, sometimes it requires taking some steps, going somewhere in a car or finding a safe spot at home.
I can also add that from a technology standpoint, there are certain types of apps that are more secure than others, and people hear about those things on the news. But that's one of the things that the telehealth work group does at Stony Brook is sort through some of that. Our information technology folks play a tremendous role in looking at security and making sure that whatever platforms we choose as an institution assure that type of patient privacy more than perhaps some of the apps that people are accustomed to using every day on their own. So some of that goes into the decision making about what is used under any particular circumstance.
Well, it's an interesting point, Christy. I think you've probably heard as we went online with instructional activities, obviously in response to the pandemic, most of our courses are using Zoom or Google Hangouts, and there have been incidents of what's now referred to colloquially as Zoom bombing of people who are not part of the organization coming in and behaving improperly. So we're learning how to protect those domains. The instructors can certainly limit who has access to the particular event. I assume we're learning the same things in telehealth too.
And this is Catherine. This brings up the issue of access and having appropriate Wi-Fi and technology to access these tools, which is why I think it was great that CAPS gives student patients, clients, the option to use their phones or the online technology.
Christy, did you want to add something there on the issue of Zoom bombing or privacy?
I think it's an ever-changing world, and just the same way that we experience getting viruses and things that come through our computer system, there's always going to be individuals that are trying to stay ahead of that, and our security officers and individuals within our information technology areas, they are the experts at this, and they stay on top of that, and they stay on top of these things that have to occur to ensure the ongoing security, just like as you described with Zoom or with any other platform.
We certainly are learning by doing in a very in an accelerated environment. Why don't we take a moment? We have a little time left. I'd like to encourage the three of you to sort of try to look forward. I know it's hard to do that. We're right in the midst of this incredible crisis, and each day is sort of feels at times like a boxing match. But looking downstream, how do you see both these practices and the new issues that have been thrown up in telehealth and telecounseling opportunities and challenges? How do you see that changing what you do and how you do it? not simply in the months ahead, but the years ahead? How do you see your practice 3 years from now, 6 years from now, given what we're experiencing today?
I'm happy to start. When we're in crisis or traumatic situations, one thing that can be helpful is to look at what are the positive things that we can get from that situation. How can we learn and grow about ourselves, about others, in what we would call post-traumatic growth. And I think telehealth, teleservices, teleeducation, that's going to be one of the positive things that comes from this pandemic, a new way of connecting, whether it be for professional reasons, personal reasons. I had a patient the other day that talked about reconnecting with family in Europe, and now they're scheduling weekly video conferencing chats. And so I think this is a new way of coming together that our society is learning about.
I can add to that as well. I think one of the things that's held back telehealth in many areas is the fear that patients have had, and even providers have an uncertainty about what will work, what doesn't work, what can be done by telehealth, what can't be. And when you're thrown into a situation like this where you have to move forward with something because you have no other choice in terms of patient safety and provider safety, that you are thrust into a new environment of learning, and you learn what has to be done. And in the process of that, you also learn what can work, and you feel better about what it is that you're doing and the positive aspects of it around the efficiency of it, the immediacy of it, the convenience of it. I've gotten feedback from a number of patients and family members that speaks to what we were talking about before, where a patient could just go into a different room and have a session with their physician. If you think about how convenient that is for patients, and once the physician is accustomed to using that particular type of technology, it's such a wonderful experience for both. So as we advance in terms of our ability to do different things by telehealth, I can't see us going backwards in many respects, because we've gotten over that initial hump of concern. And I could tell you just a very brief story that puts it into perspective. About 15 years ago, I was working with a group that was piloting the use of telehealth with an older adult population. And there are many people who have preconceived notions about who is technology savvy, who isn't, what they can and can't do. And I think we've learned over time that our perceptions are not necessarily what actually occurs. And this one instance, I'll never forget, a woman who was in her 80s, she was being monitored for congestive heart failure, and she was going to have a visit with her cardiologist. And when she got on the camera at her home, she was on the computer. It was probably one of those very big monitors that we no longer have. She had on her pearls, and her hair was done. And she said, "I'm here to see the doctor, so I want to look my best." So when you see things like that, and that was 15 years ago, you realize that this is advancing, and the train is sort of moving at this point in time at a faster pace than it may have been before, but I can't anticipate that will stop anytime soon.
The interesting piece here, too, when you mentioned earlier, Christy, about telemetry, tests and other information that a patient might send in advance of a telehealth session or during a telehealth session, and the technology that continues to proliferate around that. My sense is that will make patients more engaged and more intelligent patients. Right? They'll be more aware of, what's being tested, how it's being tested, why it's being tested. And that, I think, will make for, more fruitful interactions between patients and their care providers.
Absolutely. I think remote patient monitoring it could be as simplistic as a wearable, what we would call a wearable, which is like a Fitbit, and or much more advanced than that. But in terms of population health, if you think about how we want to keep our population healthy, we want to get ahead of disease so that we can intervene earlier, sort of like the mobile stroke unit intervenes earlier. Unfortunately, that's a much more advanced condition that we're talking about. But in terms of getting ahead of heart disease or getting ahead of other types of chronic illness, if we can help our patients to better understand how to monitor themselves in the area of diabetes, or as another example, if we teach patients how to monitor themselves, and the doctor's offices can work with those patients in exchange of that information ahead of time, the earlier you intervene in any kind of chronic illness, the more likely the patient's going to do much better over time. So the use of that technology in terms of a telehealth perspective opens up a whole new world for that.
I'd also add, just listening to you, Christy, we know that nowadays, in particular for the older segments of the population, but it's not simply the elderly, just getting to and from an appointment can be an issue. Just the practicality of doing that. So to the extent telehealth either eliminates or certainly lessens the need for actual travel to appointments, it seems to me that's also a great benefit for the patients themselves.
Yes. The travel to and from is a very difficult thing, too, for some families. If they don't have the ability to transport their older family member to and from an appointment, then you're engaging ambulances. And if you think about there's two aspects of it that we can eliminate through telehealth. Number one, the risk of having to take that patient out and move that patient depending on what their particular condition is, and also the expense for the family. If there's no reason to have to take someone out to bring them someplace, especially if it's a long distance, then the best thing we can do is try to bring that service to them.
It's the expense, and also for many people, you have to take time off from work. It can be as much as a half day, even a full day, and that becomes very disruptive and difficult as well. Catherine, anything you'd like to add in this regard?
Yeah, Healthier You is one way for employees to find community at Stony Brook. And I think if there is a silver lining for me in this, it is that, there's this incredible focus on health right now. And I think I'm sort of looking at these online platforms and different ways to reach our employees at all the different locations, clinical offices, right? It's not just the university or the hospital side, it's Southampton and clinical offices across Long Island. So if there's a way that, I can look at programming in a broader way that can be brought to people digitally to build community, that's exciting.
It is, and it's interesting how the present crisis, the emergency, has pushed us to think about how to use technology to build communities in ways we really never had before. Ironically,
right. Yeah.
I mean, this is a trivial example by comparison with the health issues we're discussing. And I was speaking with old friends last night who said they had a Zoom cocktail party with some friends who live several thousand miles away. Now, they could always have done that,
right,
but had never thought of doing it. And now, in the pressure of the crisis, said it's great. We're going to do it every week. Terrific. So I think this is going to have a lasting impact. I think across populations and across communities long after, as we hope, COVID-19 is just a memory. Let me give all three of you. We have a few minutes left. In our podcast, I want to give each of you an opportunity to tell our listeners and viewers how to participate in the activities that you lead. So, Catherine, why don't we stay with you here?
Sure.
For Healthier You, just remind people, if they're interested in Healthier You, what do they do about it?
They can go to stonybrook.edu/healthieryou to our website. They can follow us on Facebook or Instagram. On Facebook at 3 p.m. we have our live streaming meditations. We also have some live running activities happening, and those videos are archived on the Facebook page. And I should say for CAPS, again, for students who want to access the telehealth through the counseling center, they should call 631-632-6720.
And that's a 24-hour,
yes,
7-day line, always open.
Mm-hmm.
Christy?
anyone who wants to learn more about what we're doing at Stony Brook in the area of telehealth can visit the Stony Brook website. They can put into their internet browser Stony Brook Telehealth, and it'll bring them to our main site. Within that site, it gives you a little bit of information about some of the different programs that are happening in the area of treatment, and as well as education and research. And if they are interested in getting an appointment with their physician or finding out if their particular physician is delivering services via telehealth, they can certainly call their doctor's appointment to get more information about how to go forward with that.
And Adam, with respect to behavioral care, telecounseling?
Sure. So for employees and staff at the hospital, I'd encourage you to tune into our Wellness Champions channel on Microsoft Teams, as well as to our virtual support group Teams. Employees can also look at the Employee Assistant Program website that has a lot of resources available as well. For our community members, the Department of Psychiatry and Behavioral Health has opened up a new support service line, and that can be reached at 631-632-CHAT or 632-2428. They can also view our website at Stony Brook Medicine to see more resources for coping with COVID-19.
And with the moments we have left, I want to give each of you an opportunity. Is there any particular advice or message you want to share with our listeners and viewers before I sign us off? Whoever wants to go first, go ahead and jump in.
I could start. I would say, we're all in this together. We're all going through the same situation in our own ways. So have hope that this will slow down and come to an end soon. Also seek out support when you need it, not only to family members and friends, but to professionals as well. There are a lot of people out there, including us, that want to help you.
I would say the same thing, for employees, reach out for EAP and take advantage of these resources that we have. And for students, certainly we know how challenging this is for them right now, being away from campus, and reach out to CAPS. They're terrific.
I can summarize as well by saying, keep an eye on all of the positive numbers that are out there as well. The people that are healing, the people that are going home, that are getting better, and that are ready to return to work. And if you can, stay safe, stay home, and definitely give telehealth a try.
Thank you. It's a very important point to emphasize. There are victories in this war. There are successful discharges of patients from our university hospital. They go home. They recover. We shouldn't forget that. As in all wars, there are casualties too, and we're obviously deeply saddened by that. But we shouldn't overlook the victories. I do want to say in wrap up. First of all, I want to thank our guests, Catherine Duffy, Christy Golden, and Adam Gonzalez. You've learned a lot from them. Our listeners and viewers have learned a lot from all of you today about our telehealth and telecounseling efforts. And I want to note for our listeners and viewers, look at this wonderful integrated platform that is Stony Brook Medicine, right? A university hospital and other affiliated hospitals and clinics, a nursing school, a social welfare school, a health technology and management school, a school of medicine, a school of dental medicine. All of these integrated platforms enable Stony Brook Medicine not only to meet the healthcare needs of our communities, but in this incredible, unprecedented, and tragic crisis of COVID-19, as I hope you've appreciated in this discussion this morning, you can see how this integrated platform enables all of our healthcare providers in Stony Brook Medicine to make incredible contributions in caring for the community and all of its myriad needs, and to help us to wage a successful war, as I said, against this terrible emergency. So I want to thank our guests. I want to thank our listeners and viewers for spending time with us on this podcast. Thanks for being part of Beyond the Expected.